Welcome, everyone, and thank you for joining us for our Healthy Living lecture event on stroke, Recognize the Signs and Reduce Your Risk, hosted by Henry Ford's Senior Healthy Living Program. My name is Megan Brady, and I will be your moderator for today's lecture. I'm the Clinical Program Manager for Stroke at Henry Ford Health's Neurosciences Department. May is Stroke Awareness Month, so we are very excited to share this topic with you today. This afternoon, you will hear from Dr. Ahmad Riad Ramadan, a neurocritical care neurologist with Henry Ford Health. Dr. Ramadan will provide an overview of the types of stroke and the signs and what to look for if you think you are having a stroke. He will also discuss treatment options for stroke and how to reduce your risk of having a stroke or another stroke if you've had one before. Following Dr. Ramadan's presentation, we will have a time for question and answers. So if you have a question, either during or after Dr. Ramadan's presentation today, please type your questions into the chat box, and also be sure to avoid sharing any personal medical information in your question or comment. Also, to ensure a smoother experience for everyone, please turn off your cameras and note that your microphones have been muted. The lecture today is being recorded and will be available to listen to again on the Healthy Living Lecture Series webpage, which is located at henryford.com/healthylivinglectures. Now I'm happy to introduce Dr. Ahmad Riad Ramadan.
Thank you, Megan, for this kind of introduction, and thank you everyone for being here and hearing this presentation about stroke. Indeed, this month is Stroke Month, Stroke Awareness Month, and what better way to just dive into the topic. I will be, as mentioned by Megan, hopefully after today's presentation, you will be able to identify the two different types of stroke and understand their the reason why they happen. But you'll also be able to recognize the warning signs of stroke and what to do about them. And finally, we'll identify the risk factor for stroke and how to reduce those risks. So why is stroke so important, and why should it be on everyone's radar? The figures, the statistics just speak for themselves. Every 40 seconds, someone in the United States will develop a stroke. As a matter of fact, it is the fifth most common cause of disability in the US in adults. And as a matter of fact, it turns out that the majority of strokes are preventable. Up to 80% of them can be prevented. So let's take a step back and try to understand what is a stroke. A stroke happens when there is interruption of blood flow to the brain, and this interruption can happen in one of two ways. Either from a blocked blood vessel, and this is referred to as an ischemic stroke, or a ruptured blood vessel within the brain, and this is known as a hemorrhagic stroke. The ischemic stroke type is by far the most common of the two, and it accounts for about 9 out of 10 strokes. And when the brain stops getting the blood flow that carries, oxygen and nutrients, that part of the brain unfortunately dies, and this leads to a stroke. The hemorrhagic type of stroke is far less common, accounts for about 13% of strokes, one in approximately every 10 strokes. And while it is less common than the ischemic type, it tends to be more severe. A reason for this being that a hemorrhagic stroke can cause a sudden rise in the pressure within the cranium or the skull, increasing the pressure within the brain and compromising important structures in the brain that allow us to stay awake, for instance, and can lead to a state of coma. Now, hemorrhages may come in two different types, either the intracerebral hemorrhage, which is the hemorrhage within the brain matter, or a subarachnoid hemorrhage, which results from the rupture of an aneurysm, which is a sort of a pouch in the vessel wall due to a weakness in that wall that will balloon out over time and eventually rupture, leading to to blood around the brain. And there is another type, colloquially referred to as a mini stroke, and this is a TIA, or transient ischemic stroke. While it's not a stroke, it's actually a warning sign that an impending stroke may happen in the near future. And it is caused by a transient temporary blockage of blood flow to the brain. And this is the reason why it should not be disregarded or taken lightly. This is a big risk for a new stroke to develop in the near future. So what about how to treat acute strokes? You may be familiar with the adage that has been circulating in the media for some time, that time is brain. And as a matter of fact, yes, time is crucial. Time saved equals brain saved. And the reason for this is that about 2 million neurons or brain cells die every minute during a stroke. There are a few different types of treatment that can be given to a patient experiencing a stroke very early on after the onset of their symptoms. One of them is a clot-busting medication known as TPA, or we can also call it an IV thrombolytic, and how it prevents a stroke from happening or worsening is that it dissolves that clot that is blocking the artery. Now, this medication can only be given within 4.5 hours of stroke symptom onset. And this is the time duration that the FDA has approved it for. But some patients are not candidates for that drug if, for instance, they're already on blood thinners or have had a recent major heart attack or major surgery, or if, for obvious reasons, they have a brain bleed. The second type of treatment, which was approved about now 10 years ago, or a little bit more, is the thrombectomy. And a thrombectomy is a procedure. So it's somewhat of an invasive procedure, which aims at removing mechanically a clot from a blocked artery, as long as it is in one of the brain's large vessels. And the good thing about a thrombectomy is that it can actually be performed for up to 24 hours from onset of symptoms. But remember that every minute saved is brain saved, and the faster the treatment, the better. During a thrombectomy, the groin artery, known as the femoral artery, will be accessed usually, and a catheter will be threaded all the way to the brain into that brain vessel that is affected by the clot. And it will be either aspirated or stented. Now, unfortunately, some patients are neither candidates for IV thrombolytics nor for thrombectomy, but that doesn't mean that there is no care that's being administered. As a matter of fact, it is extremely important for patients to then be admitted to the hospital in a specialized unit called the stroke unit, in order to identify the cause of stroke and receive the appropriate medication, treatment, and procedures to help control the risk factors and prevent another future strokes from happening. Now, let's talk a little bit about intracerebral hemorrhage, one of the other causes of stroke or types of stroke. It usually results from an elevated blood pressure, chronic hypertension, or the use of blood thinners, also known as anticoagulants. The treatment is to reduce the blood pressure in order to prevent that hemorrhage from expanding and causing more damage over time. And if a patient is indeed on blood thinners, the treatment is to administer medications that can reverse the effects of that blood thinner. Subarachnoid hemorrhage, we touched upon it a little bit, is due to an aneurysm, so an outpocketing of the vessel wall that over time becomes bigger, and finally may rupture under the effect of, for instance, hypertension or high elevated blood pressure. The treatment is usually to secure that aneurysm via one of two different ways, either through surgery, open surgery, and this is clipping of the aneurysm, meaning preventing the blood flow from reaching that aneurysm and causing more bleeding inside and around the brain, or coiling, which is an endovascular procedure, again, going through the groin, just like the thrombectomy, and putting coils within that aneurysm in order to obliterate it. In some cases, when the stroke is very severe, swelling of the brain can happen. And swelling is a very dangerous complication because it can start compromising important structures like the ones that are, for instance, responsible for us staying awake. And in that case, a patient may actually have to undergo surgery in order to make more room for the brain to swell by taking a part of the skull out. Now, how do we recognize the warning signs of a stroke? Since stroke is an emergency and time equals brain, it's important to seek medical help as soon as a stroke is suspected. And we've made it easy. There's an actual acronym for it in order to remember what the symptoms are. It's called F.A.S.T, or F-A.S.T. F stands for facial droop on one side. So ask, for instance, the person to smile or look at a mirror. A is for arm weakness or numbness, especially when it's on one side. So ask, for instance, the person to raise their arm or raise their leg. S is for speech difficulty or slurred speech. So ask, for instance, the person to repeat a sentence or simply to speak. And T is for time to call 911. Do not drive the patient yourself to the hospital. Do not drive yourself to the hospital. Call the EMS because they have the capability of alerting the hospital that the patient experiencing a stroke is on their way, and they can activate the stroke team for delivery of care. But strokes may also have other kinds of symptoms that come on suddenly, such as, for instance, numbness or weakness of the face. We said already the arm, but also the leg. Confusion, trouble understanding, trouble with vision in either one or both eyes, trouble walking, balancing, trouble with coordination, or dizziness, vertigo. Or, for instance, such as in the case of subarachnoid hemorrhage or intracerebral hemorrhage, severe headache. So how do we go about reducing the risk of stroke? Some risk factors, unfortunately, cannot be changed, such as, for instance, age. Above the age of 55, the chance of having a stroke doubles with every decade of life. Or the family history. Your risk is almost twice as high if you have a parent or a sibling with a stroke. Race. Unfortunately, Black Americans are at a much greater risk of developing a stroke and dying from a stroke. And finally, sex. Women are actually much more likely to have a stroke than men and to die from it as well. However, some risk factors can actually be changed. And as a matter of fact, 4 out of 5 strokes can be prevented with just healthy lifestyle changes and by working with your doctor in order to control those conditions that are known to raise your risk of having a stroke. And so we follow life's essential 8 for lifelong good health. 1 is eat better. So consume more whole foods, leaner proteins, lots of fruits and vegetables, and try to avoid tropical oils. 2 is be more active. 2.5 hours of Moderate or 75 minutes of intensive physical activity and workout per week is also a good way to reduce the risk of stroke. 3 is manage your blood pressure. Work with your doctor to control high blood sugars. And if you have diabetes, monitor your A1C. 4 is managing weight. Your optimal body mass index, also known as BMI, is 25, and you can calculate it online and talk to your doctors about ways to reduce your BMI. 5 is controlling your cholesterol. There's the good cholesterol and the bad cholesterol, also known as the non-HDL cholesterol. And this cholesterol can lead to heart disease and stroke. So talk to your doctor about how to lower your levels. Manage your blood pressure. Keep your blood pressure in an acceptable range. And by acceptable, we mean usually for the top number, also known as a systolic, less than 130 to 140. And for the bottom number, also known as the diastolic, less than 90 or less than 80 to 89. Quit tobacco. Cigarettes, tobacco in any form, cigarettes or e-cigarettes, vaping, all of them have been associated with increased death rates. And that's not just in stroke, but also in pulmonary diseases like COPD and lung cancer. And it is the leading cause of preventable death in the United States. And this cannot be overinflated or over emphasized. Healthy sleep. So most adults need 7 to 9 hours of sleep each night, and this has also been shown to reduce the risk of stroke. I'd like to pause for a second and talk about this condition that you may have heard on the news or in the media, known as AFib or atrial fibrillation. It's an arrhythmia, so a disorder in heart rhythm. In AFib, the atria, which are the upper chambers of the heart, start to quiver instead of beating effectively. Blood then stagnates and can easily form clots, which then can get ejected from the heart and then go lodge themselves in a blood vessel within the brain, causing a stroke. As a matter of fact, AFib increases your stroke by 5 times. And so if you have AFib, you may need to go on a blood thinner in order to reduce your risk of stroke. Another condition I'd like to quickly talk about is carotid artery disease. And the carotids are those arteries that are in the front of your neck on the sides, and they're the major blood supply to the brain. Over time, and with some risk factors like smoking or hypertension, cholesterol plaques can start building up in those arteries, which over time will cause that artery to narrow. At some point, that plaque can rupture and form a clot and acutely block blood flow to the brain. And so for those who have carotid artery disease, you may need to be treated either surgically by removing that cholesterol plaque, and that's known as carotid endarterectomy or CEA, or having a stent placed through endovascular techniques, and this is known as carotid artery stenting. I can't overemphasize the need for a healthier lifestyle. Taking your medications as directed is probably the #1 benefit in reducing your risk of stroke. And get your blood pressure under control and checked regularly with your doctor. Decreasing your level of stress is also extremely important, and seeking the emotional support from friends and family, and also have regular medical checkups. I'd like to also talk briefly about the different stroke centers that Henry Ford possesses. Across all 5 Henry Ford Health hospitals, as well as the 5 freestanding emergency departments, our team of stroke experts respond to every stroke call and offers the latest and evidence-based treatments in stroke care. All 5 of our hospitals have the Joint Commission certification for stroke at different levels. The Henry Ford Hospital main campus in Detroit has the highest of those levels, which is also known as the Comprehensive Stroke Center. Thrombectomy, or that procedure we talked about earlier that aims at removing a clot from a large blood vessel in the brain, can be performed at 3 different locations: Henry Ford Hospital main campus, Henry Ford West Bloomfield, and Henry Ford Macomb. Across all Henry Ford sites, however, protocols are in place to arrange for speedy transfers to our sites that can perform those acute stroke therapies. Outpatient follow-up care, post-stroke, and for stroke prevention are also available across the Southeast and Central Michigan region across our centers. And inpatient rehab for stroke survivors can be found at Henry Ford Wyandotte and Henry Ford Macomb. Finally, outpatient rehabilitation, physical occupation, and speech therapy are also offered across several locations. And for more information, you can go on our website, www.henryford.com/stroke. So in conclusion, a stroke is definitely a brain attack. It can happen to anyone at any age, at any time. Remember, 2 million brain cells die every minute during a stroke. And so medical treatment is absolutely crucial. And it may reduce the effect of stroke if it's administered in a timely fashion as soon after the onset of symptoms. So think and act fast to save a life and call 911. Stroke is and can be prevented. Thank you so much. With that, I'm happy to take any questions.
All right. Great. And I do see some questions coming into the chat. So I want to start by thanking you, Dr. Ramadan. We also wanted to be sure to share information with the group about our newly launched stroke survivorship group. This group meets monthly to share experiences, offer support to one another, and provide opportunities to connect and socialize with other survivors of stroke. So if anyone here is personally interested or has a loved one who is interested after experiencing a stroke in joining a group of survivors of stroke, please feel free again to visit our website, which can be found at henryford.com/stroke. And on the side, there's a place for stroke resources. There's a form there that you can fill out. So I'll be sure during the questions that are being answered to enter that into the chat, that website link and a phone number as well if you're interested. All right, so we do have some questions coming in here. The first question that I see is, what is the ideal blood pressure for women in their 70s or above?
That's an excellent question. The guidelines, the current guidelines state 130/80 and less is the optimal target, with the caveat that some patients may be allowed to have a slightly higher blood pressure up to 140/90 if, for instance, they have a very tight, stenosis or, narrowing of their carotid, for instance, in order to not drop the blood pressure too low and cause less blood flow to the brain. But in general, I would say 130/80.
Okay. There is another question here as well. So if you are on a blood thinner and therefore cannot receive a clot busting medicine, how would you then be treated if the team thought you were experiencing an acute stroke?
Excellent question too. And this is a scenario we come across a lot in our emergency departments. If the patient is on a blood thinner and therefore cannot get the TPA or the intravenous thrombolytic, if they do have a large vessel clot, so a clot sitting in one of the large vessels within the brain, they may be and very likely will be a candidate for the procedure known as thrombectomy, which is the procedure that aims at removing mechanically the clot from that vessel.
Great. All right. Continue to come through here. All right. So if you are over 55 or 60, Should your primary care provider always check carotid arteries during a wellness visit? Sometimes it says, sometimes my physician will put her stethoscope to my neck to listen to carotid arteries. Is this sufficient? When is it necessary to have more advanced testing of our carotid arteries?
That's also an excellent question. It may not be necessary, and it all depends on the risk factors. And those risk factors, we've talked about those that can be prevented and those that are not preventable. Um, uh, Putting a stethoscope on the neck could potentially pick up what we call a bruit, carotid bruit. Bruit in French means noise, essentially, and be a sign of a tightening in the vessel, but it may not be enough at all, and it may not be a very reliable tool. So if you do have the appropriate risk factors, and digging into your history of symptoms, any sign that you may have had a TIA, for instance, so a mini stroke, you may need to undergo more testing, such as, for instance, a carotid Doppler or duplex, which is essentially an ultrasound of your carotids in order to detect that plaque and that narrowing of the vessel.
Thank you. All right,
Absolutely.
I think this goes along with the blood thinners here, but a question is, if you take 81 milligrams of aspirin, is it possible to have the treatment for clots if you're having an acute stroke?
Yes, this is also, all these questions are fantastic. Yes, you are still able to, or still eligible to have and receive the TPA medication. So that category of drugs known as the antiplatelet drugs, like aspirin, for instance, or clopidogrel, also known as Plavix, are not contraindication to getting TPA.
Great. So in terms of risk factors, somebody noticed that women are at higher risk of stroke. So the question is, why is that?
So we think that there is a hormonal influence and factor that plays an important role, and that hormone is estrogen, and the ratio between estrogen and progesterone, which can, after the age of 55, make a woman more likely to have a stroke. So there are changes that are due to hormonal variations throughout life.
Great. Okay. So one of the participants said that her mother had many strokes
Mhm.
and was later diagnosed with Alzheimer's. Does that increase this participant's chance of either one, so the mini strokes or Alzheimer's?
Yeah, all these are fantastic questions. I cannot even tell you how good they are. Yes, it goes both ways. The risk of Alzheimer's increases with the risk factors of stroke. So say, for instance, someone who has uncontrolled diabetes or uncontrolled hypertension is at a higher risk of developing Alzheimer's disease and dementia. So this is part of it. Now, a patient with strokes, especially repeated strokes over time, can develop what we call vascular dementia. So it's a type of dementia different from Alzheimer's, but essentially that comes in a stepwise fashion. Every time someone has a stroke, they may experience more cognitive decline. And with more and more strokes, there's accumulation of brain injury that leads to eventually to dementia, loss of memory, behavioral changes, and the need for support and assistance.
Great. All right, I see another one here. It says, can the symptoms of heart attack and stroke be similar?
Yes, absolutely. Actually, most risk factors that are risk factors for stroke are also risk factors for heart disease and heart attacks. Same thing goes for those who develop cholesterol plaques in their limbs, and those who get amputated of, say, a leg. because of poor circulation to their legs. Those risk factors are usually age, but also high blood pressure, high cholesterol, diabetes, and smoking. These are the most common risk factors that overlap between the different conditions, stroke, heart, and peripheral vascular disease as well.
Great. And how about the symptoms of both? So we heard about some of the symptoms of stroke. Are the symptoms of heart attack similar in any way, or are they different?
So they are different. However, sometimes when someone experiences a heart attack, they will have the classic left arm pain and sometimes even weakness in the left arm, and that can actually be confused for stroke. So we do have, we do see, as stroke experts, stroke, what we call stroke mimics. So they're not real strokes, but the symptoms mimic the symptoms of stroke, and it's important to tease out those conditions in order to administer the right care. So it's mostly when it comes to the actual weakness and numbness and or sensory changes that travel down the left arm.
All right. So another question here. Um, Someone has a partner who's had a small stroke.
Mhm.
He is on a blood thinner, and should he be taking aspirin? He is diabetic.
Good question. It all depends, and so this is why it is very important for us as stroke doctors to identify the cause of the stroke. So we talked about the big categories of ischemic strokes and hemorrhagic stroke. If you take the ischemic stroke, there are also different subtypes. Some of them are due to cholesterol plaques in large vessels, like in the carotid, for instance. Others are caused by atrial fibrillation, AFib, so a clot from the heart that gets dislodged and travels to the brain. And there's also another type of stroke that is known as the small vessel disease or lacunar stroke, which is neither of those two and usually leads to small strokes, but if in strategic locations, can cause devastating disability. And so depending on what type of stroke we're talking about, the treatment is going to be different. So for instance, atrial fibrillation has to be treated with blood thinners like warfarin, for instance, or like apixaban, whereas a carotid disease has to be treated with aspirin, Plavix. And so, yes, he may be on a blood thinner. It may or may not cover that particular type of stroke to prevent it from recurring. So it's extremely important that we do a thorough workup in order to pinpoint, identify the exact mechanism of the stroke.
Great. I see one more here so far. It says that someone has a relative who had surgery and had some cognitive decline after surgery. Some of that cognition returned, but the question is, how can anesthesia impact the brain?
Anesthesia can impact the brain. Anesthesia is essentially a way to suppress the brain activity so that you don't remember and so that you don't feel pain. In patients who have dementia, anesthesia or really any illness procedures can take a toll on the person. This is the concept that I teach on rounds, for instance, to my trainees, my residents and fellows. We talk about the concept of cerebral reserve or brain reserve. So having, a lot of shrinkage in the brain because of atrophy over time or different diseases, maybe strokes, that accumulated over time, can essentially put the brain at in a more vulnerable state. And so some even minor illnesses that otherwise would not cause significant problems in terms of cognition in a healthier individual may actually be very dramatic for someone with cognitive, decline and dementia. Same thing for anesthesia. It may take a much longer time for someone who has dementia to come out of surgery and come out of the anesthetic effects.
Great. And just as a reminder to the participants that if you do have a question, to open up your chat box and you can type your question into the chat. So they're still coming through, and I agree, these are great questions. So question here is that, somebody that's had chronic headaches for most of their life,
Mhm,
at, about the age of 70, how would someone know the difference if the headache was a symptom or a warning
mhm,
sign for stroke?
mhm. I'm going to be honest, the patient, uh, him or herself will know the difference, because the headache doesn't feel the same. Usually headaches, caused by a stroke, mostly, and we mentioned that earlier in the presentation, subarachnoid hemorrhage or intracerebral hemorrhage, that headache tends to come on very quickly. It's also known as a thunderclap headache. It's probably the most intense headache you will ever experience in your life. And when it comes on very quickly within a matter of seconds. So it's different than tension type headache or migraine, which can build up over time in intensity.
Right.
Great questions. That's
Yes.
fantastic.
So, somebody that has experienced a stroke, what is their risk of having another stroke?
Great question. Their risk is significant. It also depends on what type of stroke we are talking about, what's the mechanism of it. But you may be anywhere between 2 to 5 times more likely to have a stroke in the future. There are different percentages. We could get into the nitty-gritty of it, but the risk is definitely much higher than someone who's never had a stroke before. Again, reinforcing the need to understand the mechanism of the stroke, because it could be very easily preventable.
Yep. So another message also to work with providers and follow any
Mhm.
recommendations that they may have. Okay.
Not two
Um,
strokes are the same, and so this is important, to seek medical help and go through a thorough stroke workup.
so a participant said that having had a mild stroke around 6 months ago, and being put on Xarelto, and wishing to not continue on blood thinners into the future. So is there a way to discontinue blood thinners?
There is. There are actually alternatives to blood thinners. They may not be as good as the blood thinners. They are also more invasive. So for instance, if you are on a blood thinner because of atrial fibrillation to prevent your risk of stroke, but cannot no longer tolerate the blood thinner because most common causes are repeated, falls, or for instance, bleeding in the GI tract. Well, sometimes changing the medication for another one that has a lesser, side effect profile may be an easy fix. But other times, even, if you are on the safest of those medications, you may need to be considered for a procedure, which is a cardiac procedure that essentially separates a part of the atrium, so those upper chambers we talked about that start quivering in atrial fibrillation. There's an appendage, like an appendix to it, called the left atrial appendage. And this is actually the site where clots form, and it's not needed, it's an appendage. So it's not really needed for the proper function of the heart. And by clipping it off, which is obviously a surgical, treatment, you could actually come off of blood thinners in the long term, and it would have a similar effect to reducing your risk of having a stroke.
Great. All right. So someone said that shared that they have experienced an ischemic stroke, but weren't aware of it, so didn't know when it occurred.
Mhm.
Being over 65, still experiencing menopause, and having high cholesterol. Question is, might the reason be all of the above in terms of those risk factors?
Yes, absolutely, absolutely. And sometimes strokes are silent because they occur in parts of the brain that are not. We use that term in the medical community. We say eloquent. So essentially, silent strokes. We find them on imaging. So doing a CAT scan or an MRI for other reasons, and we find that, oh, that individual had a stroke. The treatments, the risk factors are all the same, and the treatments are all the same. It's not because they were silent and didn't cause symptoms that they should be treated in any other way. In a way, it's luck. It's being lucky to have not had, symptoms related to it, but the risk of having another stroke in the future is the same. And so it needs to be, treated similarly.
Great. All right. So while people are thinking, I do have one more question,
Mhm.
but I also want to ask a quiz of the audience because we do want to make sure that you understand the signs and symptoms of stroke. So if you could type into the chat what F.A.S.T stands for. So to the participants, if you want to take a moment and remember what FAST stands for, and quiz yourself and answer in the chat what FAST stands for. So Dr. Ramadan, I know that the American Heart, American Stroke Association, prior to Life's Essential 8, had Life's Simple 7. So it added an 8th risk factor or really healthy activity to do, which you mentioned being healthy sleep. So just a question to you on why did they add healthy sleep to their list of healthy activities in order to prevent cardiovascular disease?
It's interesting. I think sleep has so many different effects on the body, and particularly the brain. It is not only for stroke, but for absolutely every brain disease. The brain needs its rest. There is a lot of cleaning up that happens during sleep, where toxins that built up, during the daytime are actually being, washed out or excreted. And this is one of the reasons why good sleep is extremely important in order to promote, brain health in general. We're talking about brain health in general. Also, another risk factors that we haven't really talked about is sleep apnea. And it is an actual recognized risk factor for stroke. And the reason for this is that during in patients who have sleep apnea, during the nighttime, their oxygen levels in the body, but also and specifically in the brain, can drop to very low levels, and that can essentially cause the vessels to harden over time and predisposes, patients to strokes, as well as heart failure and heart attacks. So it's extremely important that if you think that you have obstructive sleep apnea, that you get it checked out. And so you may have to undergo what we call a sleep study in the hospital in order to detect obstructive sleep apnea.
Great. All right, so I'm looking in the chat and seeing a lot of great answers. So it looks like everybody does remember what FAST stands for. So F is for facial droop, A is for arm weakness, S is for speech, slurred speech or trouble speaking, and T is for time. So any of these symptoms means it's time to call 911 and go by ambulance to the hospital for potential treatment, because there are things that can be done to potentially treat that and stop the stroke from moving forward. The question is, do we get a prize? Yes, you get um, uh, a
No
badge of
strokes.
no strokes, yeah, reduced risk of stroke. So thank you very much. I'm not seeing any other questions. We did want to mention also in celebration of Stroke Awareness Month that we are participating in the American Heart Association, American Stroke Association's Heart and Stroke Walk for the Metro Detroit Heart and Stroke Walk, which is taking place on Saturday, June 3rd at Comerica Park. And more information about that event, if you're interested, can be found online. All right.
Thank you, Megan, for that.
I think so. Okay, so this, I believe, brings us to the end of our event. As a reminder, this lecture has been recorded. It will be available to watch again or share with friends and family members. So please feel free to visit henryford.com/healthy living lectures to view the presentation. The recording will be available in the next couple of weeks. So on behalf of Dr. Ramadan and the Senior Healthy Living Program, thank you all for joining us today to learn more about stroke and how to reduce your risk. I hope everyone has a great day.
Thank you, everyone. Bye-bye.